Clinic in Toronto, author of Pathways to Pregnancy, and your life and fertility coach. So today, this is my 100th interview. So this is so awesome. I am really honored to be here in Belgium with you. And in Toronto, it's probably about 5:30 in the morning, but we're here, what time is it now? Like a
quarter to noon.
So it's almost noon here. So we're doing our interview, and I'm so honored to have Dr. Christiani Amorim here with us. And she is a professor at the Catholic University of Louvain and in Belgium, in Brussels, where she has been working on cryopreservation, meaning freezing of ovarian tissue and development of a transplantable bioengineered ovary, which is short form for TEO, and to restore fertility in cancer patients. Her pioneering studies on TEO serves as a basis to start the field of ovarian tissue engineering, and she's been actively organizing the first group on reproductive tissue engineering. So I'm so honored to have you here. Thank you for being with us. I have lots of questions for you. But first, just a little bit more background. She's been working here on this for 11 years, and prior to that, she had been working on animals, right?
Yes, I'm originally veterinarian.
Okay, as a veterinarian, and now working on humans, which is so fantastic because, you know, as you might know, for those of you watching, it's been exactly 40 years since the first IVF baby came along. So, you know, and back then that seemed like science fiction. And so now talking about this, preserving of ovarian tissue, it might sound like science fiction, but maybe in the near future, it'll actually be a reality, or perhaps you can enlighten me. First of all, what is ovarian tissue cryopreservation?
Well, it's, as you said before, it's the freezing of ovarian tissue, and it's already a reality. In the last 20 years, we have been working on this. We have our cryobank here in the hospital. We started our cryobank in 1997. We grafted the first patient in 2003. Wow. It was the first baby worldwide. And since that time until now, we have more than 130 babies born out of this technique.
Wow. Okay, so tell me exactly what happens in the technique. What are you doing?
So we, the target group of patients for this technique are cancer patients that cannot benefit from embryo cryopreservation or oocyte cryopreservation because they're too young, like girls,
right?
Or because they have no time to do the superovulation to have the oocytes to collect and freeze.
Okay, so we're going to talk in lay people terms.
Yeah.
So basically, so when cancer patients, they could be very young, like let's say you're not even ovulating yet, probably, right?
So small girl.
Right.
Yeah.
So then what you're doing is you're taking some of the ovarian tissue, storing it, so when they become adults, you transplant it back?
Yeah. So the idea is that once the girl is diagnosed with cancer, she'll come to us. We'll do a laparoscopy. We remove a piece of the ovary. We freeze it. We store it until she's adult and she wants to become pregnant. And she'll come back to us. She's no longer sick. So we transplanted, and in a matter of a few months, she started having her period, and she started having the ovarian function back. And at that point on, she can eventually become pregnant.
That's amazing. Yeah. So then what you're telling me is, like, since childhood and when they hit puberty, they don't go and actually have a period because of the treatment for cancer, right? You know, it could be quite harsh. But then when it's time to have a baby, they're transplanting back this tissue and it restores their function.
Yeah.
That's incredible.
Yeah, we have, from all the patients that are transplanted, we have ovarian tissue function back in more than 95% of the patients.
Wow.
Yeah.
But it's not really being done worldwide, is it?
Yes, it's growing. The problem is that the technique is still considered experimental.
Yes.
So there is still some Not so much, but there is still some people that feel uncomfortable to suggest this to the patients. But we have many centers here in Europe that are applying this technique for the patients.
Right.
In United States, they also have it. In Israel, there are many countries that are already starting this in the last years.
But not Canada yet.
As far as I know, no.
But soon.
Yeah.
Okay. Well, I guess then, you know, when a person's faced with cancer, the last thing they think about is trying to have a baby, especially if you're a little girl. Mm-hmm. So
that's why it's important for the oncologist to know and suggest this to the patient. Because, well, if you're an adult woman, you probably are considering this because you know that this type of treatment, it will affect the fertility.
Yes.
So you may think, well, if I don't get pregnant, what will happen? We have a lot of patients now with the internet. They just Google what they can do, and they suggest this to the doctor. But young girls, they don't know. So it's
well, no. When you're a young girl, you don't think about that at all.
No, just want to be cured.
Yeah, absolutely.
Yeah. So it's the oncologist who must know and tell this to the patient, suggest this to the patient.
But that's not happening very much.
In Belgium, yes. In Belgium, we had a big effort showing the results, and now that they see that this procedure is working, we have all the oncologists suggesting this to the patient.
Wow, that's amazing. So what else? So cancer patients, that this technique, is it, I think you're using it for other things now, yes?
Yeah.
Okay, so tell us more about that.
We have also for types of diseases that are not malignant diseases, like we have benign conditions like endometriosis when they affect the ovaries. We have patients with Turner syndrome. We have patients who have history in the family of premature menopause. All the patients who need to go through irradiation for bone marrow transplantation, like patients with anemia, some sort of anemia. So these patients can also benefit from transplantation of ovarian tissue.
Okay, so
cryopreservation transplant.
Right. Okay, so then let's go back to if a person is in a family where you say the mother has a premature ovarian failure or a premature menopause, right? So you say that person can benefit, but are they benefiting when they're at that age, or are you talking they take the tissue out when they're young?
When they are young.
Okay, so it's not going to work if they're like 30 then?
No. Okay. Probably the likelihood that it will work is very, very low.
Okay. So for those of you who are given the diagnosis of premature ovarian failure or poor ovarian reserve, I don't know if this is actually we always want the magic thing, right? The next thing. And if you're given the diagnosis of POR, poor ovarian reserve, then this is not it, right? Because
it may
help.
It may help if you want to preserve a part of your follicle population for later on when you are ready to become pregnant. Like if you're very, very young and you don't consider getting pregnant now, you can freeze a part of your ovary and put it back later on, so your ovarian reserve, it won't be wasted throughout the years while you're not sure if you'll become pregnant or not.
Okay, so really it's for women, let's say, then it's probably better for single women that are like, oh gosh, I don't know when I'm going to meet the guy, and right? and there's a history of premature menopause. But then I guess other women, they just don't know the history. I mean, the reality is that women are delaying trying to have children, right?
Yes.
And men.
Yes.
So, can that now become a factor in choosing this technique, or?
It may, if you consider that now the age of women becoming pregnant is increasing, like in most developed countries, they are now reaching higher than 30, 35 years old.
Absolutely.
You may consider to freeze your ovary for the quality of the oocyte.
Yes.
Because you know that you get older, the oocytes also get older. So maybe just to avoid this problem, you can freeze a piece of your ovary early on and transplant it later.
See, that to me sounds better than what everybody's doing right now, which is freezing their eggs.
Yes.
I think it sounds way better because you have to undergo IVF retrieval, all the hormonal drugs, and this way, and it's still a surgical procedure plus extra hormones. So to me, this actually sounds better because it's a procedure. Yes. Is it through the abdomen, a laparoscopic?
Yes.
Okay.
It's one day in the hospital. So usually here our patients arrive early in the morning. They are put in the surgery room like the first or the second patient, and they leave later in the afternoon.
Right.
So
wow,
they don't even need to sleep in the hospital. It's still a procedure, a surgical procedure, but one day.
Right. So what percentage of the ovary will be taken, the tissue?
It will depend. It will depend on the diagnosis that you have, and based on the diagnosis, the type of cancer that you have, for instance, it will require more harsh treatment like alkylating agents that it's quite strong on your ovaries. And if you are not that young yet anymore, so we consider removing one whole ovary.
And then transplanting the whole thing back?
No, we cut fragments.
Okay.
We freeze fragments of the ovary, and then we transplant a few fragments every time that we need, because the lifespan of the graft, it's about between 4 and 6 years. So in this window of time, if you don't become pregnant, or if you want to have a second baby, you can come back and we transplant more fragments again.
And so you've done that?
Yeah.
Wow, that's crazy. Okay, so I've never heard of this, and no, seriously, because in Canada we don't talk about it, and I don't think.
Yeah, that's why I'm going to Canada in September.
Yeah. So yes, and this is why I got in touch with you, Christiani, because I saw her lecture notes, or not the what do you call it? The summary of what she's going to talk about. So I'm like, oh my gosh, I have to get in touch with her, because she's going to come to Canada in like 2 weeks. And I'm going to be speaking as well. And she's going to be speaking at the Canadian Fertility and Andrology Society. So I was really excited, but I thought, oh my gosh, I can't wait. And I have to talk to her now while I'm in Belgium, right? So why not? So I'm going to look forward to hearing her speak there more in depth. And all right, so I guess talking about all this, who are the patients that will not benefit?
So we keep saying that, well, cancer patients will benefit from cryopreservation of ovarian tissue, which is right. But not all patients can benefit from transplantation. So patients who have some types of cancer that can metastasize to the ovaries, of course, we cannot transplant the ovary back because we're bringing the disease back.
Right.
So for these patients, we still don't have an alternative. So like young girls with leukemia, we do cryopreserve the tissue, but we tell them for the moment there's nothing we can do. Okay. So leukemic patients or patients with neuroblastoma or Burkitt lymphoma, we cryopreserve, but we don't transplant.
Oh,
so,
I see.
Yeah.
Until maybe in the future there's something you can do with it.
Yeah, the idea is that we are doing here is developing the bioengineered ovary. So for these patients, we can offer this. So instead of transplanting the normal ovarian tissue, we'll rebuild an ovarian tissue, and transplant it to the patient.
You rebuild, okay, so this is the bioengineering stuff, which is very cool. And so what are you using?
So we know there are malignant cells in the ovary. So what we do, we isolate the follicles, being sure that we don't bring the cells together. So we isolate the follicles. Once the patient is cured, we remove the remaining ovary because there's no malignant cell anymore because she was treated. We isolate some essential cells that remain in the ovary that support the follicle development. We isolate those cells, we put everything in a three-dimensional matrix, and we transplanted this to the patient.
That's crazy. See, it is totally sci-fi.
Yeah. Okay. Looks like.
So, when you do that, then do you retest to make sure that there's no malignancy?
Yes.
And yeah, okay. And then you grow the tissue in the lab.
We don't grow. We just we assemble everything and we transplant it. We don't have any results in human yet, but we have some promising results in mouse.
Wow. Okay, so it's in mice yet, not in humans.
No,
yet.
Not yet. The next years.
Yeah, and when do you think that's going to happen?
I hope in the next 5 years or so. Wow.
Okay, and then how long does it take to have that process where you actually bioengineer the physical ovary?
Yeah, this is the part that we're struggling most, is to find the appropriate metrics to put the follicles, because human follicles are very peaky. They need the environment where they can feel, they can remain the three-dimensional structure. They're not like mouse follicles, and they need a lot of supportive cells that are connected with them. So we know which cells we can transplant it, but the metrics, we are having some promising results, but we're not there yet.
Okay.
So this is our research for the moment.
That's amazing. Okay, let's see what else. Okay, well, how about postponing menopause? And people are, of course, really fascinated with that, as we are talking about, we're all delaying trying to conceive, right? So,
So we know that now in this century we're living a lot. In Canada, United States, and Belgium, women are living up to 85 years old. And well, when you're 85 and you we had your menopause at 50, you still have 35 years of menopause. So a lot of women cannot take the hormonal replacement therapy that are offered now because they have some side effects. So you just have to live not in the top condition, because you have all the problems linked to menopause, like depression, you have osteoporosis, heart problems, there, you name it.
I'm there already, honey. Like I am. So I'm saying to live to 100, so I'm in trouble.
No, maybe not. So what we could do for these women, and one thing that we have been discussing a lot, is what if when you were in your early 20s, you freeze a piece of your ovary and keep it there, because we know that if you remove a piece of your ovary, it doesn't affect the age that you become menopaused. It's 1 year difference if you remove one entire ovary or if you have both ovaries. So somehow the other ovary, the remaining ovary, compensates. So you don't get menopause early if you remove a piece of your ovary. So you remove a piece of your ovary when you're young, you freeze it, and when you start having your menopause, you start transplanting pieces of your ovary, and you keep producing estrogen and the hormones that you're producing before.
Wow, so but then that means you're going to be menstruating until you're 90.
Eventually, depending how much tissue you froze.
Right. I don't know if I actually like that, but there are definitely benefits, right? Because you keep your bone structure and the health of your skin and your rejuvenation. And, you know, as women, we love talking about, well, we don't love talking about aging. And so it's one way, you know, instead of getting a facelift, you get your cryopreservation, right? Of tissue. That's one way to do it.
The advantage of doing this to delay menopause is, like when you have to transplant your tissue to become pregnant, you have to do another laparoscopy to put your tissue back where it used to be. But if you want to transplant your tissue to delay menopause, you can do under your skin. So you can just go.
Oh, the transplant is in the skin, not into the ovary. Because why you don't need it?
You don't need it. You don't want to become pregnant. So you just go to a doctor. He'll just give you a local anesthesia, open a little piece in your skin, and stick a few pieces of ovarian tissue, stitch it in 1 hour, it's done.
So it's just a little skin graft then, and then you go back once in a while to get your tissue. That's insane. Okay, but you know, most people here are talking about fertility itself. So again, it's not really about delaying menopause in terms of trying to create a baby, because if you don't have the tissue to begin with, it's not going to help us in trying to conceive.
And of course, we are not suggesting people to become pregnant when they're 55 or 60 years old. This is also, the body cannot handle that. So it's more just delaying menopause.
Right. Okay. So again, this is not really actually fertility related. It's just extending your quality of life in one way. We do it with Chinese medicine, but here's another way. And I do believe in the marrying of both worlds, because they work together really well. And, you know, if you're enhancing blood flow and collagen and all the rest of it, then why not, you know, use the two in conjunction? One helps the other, right? Okay, well, I think that was really fascinating, and I can't wait to hear you speak.
Thank you.
Thank you so much for being with us.
Great topic.
Yeah, it's a fantastic topic. We could talk about it for weeks. So thanks, guys, for watching. I know you're all sleeping, but you'll wake up and watch this. And so next week, we'll talk again. But I also want to allude to the fact that on Sunday, September the 9th, I'll be having my live monthly fertility circle where I'll be supporting you as a coach to get through your journey, to provide you hope and tactical solutions in navigating your life and helping you become more fertile. So please tune in and sign up through marywong.life. That's marywong.life. And check out my book, Pathways to Pregnancy. Oh, and yes, and I'm going to leave you a copy for that.
Thank you.
We can share that in Belgium. And please do check out, because I have 100 posts, and it's an honor to have you as my centurion post.
Thank you. It's an honor to be here too.
And so go check down below, like my Facebook page. And the other way to do it, if you don't actually have Facebook, you can go into marywong.life under videos and click on that. There's a YouTube channel, and sign up for that, and you'll be able to see my posts every week. Okay, so thanks for being with us. Have a great day, and we'll see you next week. Take care. Bye for now.